Hello, my name is Cole Jones, and for my health fair topic, I picked hospice care for the incarcerated. First, I wanted to run you past some numbers. Numbers of states that have obligation to provide medical care to individuals in prison, pre-Estill versus Gamble. That's all 50 states. A number of sentenced prisoners age 50 or older as of 2017. This number is greater than 20%. Number of individuals in prison serving life sentences, this number is greater than 150,000 people. Approximate number of prisons with hospice care programs, out of the 2,000 total prisoners, there are only 75 prisons that run this program. Number of states that have established medical parole in statute or regulation, that's 45 out of the 50 states. Number of states that have generic parole laws in statute, that's 17 out of the 50 states. Number of states that have both medical and generic parole legislation, that is 16 out of the 50 states. Approximate number of states that have compassionate release policies, prisoners may be eligible for early release on the grounds of extraordinary circumstances. This either has to do with their health condition or like it says, an extraordinary circumstance. This is 45 out of the 50 states. Why is prison hospice care needed? Outside prison, hospice care patients often receive reports from relatives, friends, and loved ones. In prison, this can be kind of tricky. Your relatives, friends, and loved ones cannot always come and see you, but other inmates can volunteer to help nurses or doctors prep patient care. Inmate caregiving and training is done by hospice nurses, and prison doctors. Many inmates have found that providing end-of-life care was a transformational experience for not only the patient, but also the prisoner's caregiver. Hospice benefits not just the prison who use the time to reflect on past mistakes and make amends, but also positively impacts the staff or other prisoners tending to them. Hospice care qualifications. These are the same qualifications as if you were on the outside instead of being in prison. They go hand in hand. So patient has to be diagnosed with a life-threatening condition with a prognosis of 6 months or less if their disease runs its normal course, progressive weight loss, increasing weakness, fatigue, a change in cognitive and functional abilities, ADLs, activities of daily living, such as eating, bathing, dressing, toileting, and even just walking. Deteriorating mental abilities, skin breakdown, specific declining condition, any one of these can help you get qualified for hospice. Hospice care. So hospice prison care is, like I said, the exact same as regular hospice care. Most hospice nurses, they help with ADLs. As I said before, it's activities of daily living. They help the inmate perform their daily activity of living, either if it's eating, bathing, dressing, toileting, and as I say again, just walking. They provide medication, emotional support, and in my opinion, this is a way of therapy for dying. I have next to share with you a story about Fernando. He signed up for a prison hospice program in Vacaville, California. Vacaville Institute is in California, and it was the first prison to actually admit this program in the early 90s. And I just have a quote from him. Fernando, who volunteers in Vacaville's hospice program while serving a 41-year sentence, that incarcerated volunteers gain a new sense of purpose and psychological rehabilitation through end-of-life caregiving, which can lead to a more peaceful prison culture. The report points out, however, that pain management and trust are two barriers to optimal in-prison hospice care. Many doctors and nurses are cautious about dispelling pain medicine in a place where drugs already run rampant. Many prisoners have trouble trusting authority figures, even doctors and nurses. So I think prison hospice care programs are wonderful because they allow inmates to help other inmates that are in life-threatening conditions. And it just shows that um, not everybody is out to get you or out to hurt you. Having other prisoners help doctors and nurses in these institutions can really show and just give that patient hope and show that they are really trying to help their end of life experience. And again, I want to hit on awareness. Joe Avila, the National Director of Special Programs and Angel Tree Sports Clinic for Prison Fellowship, he worked also in prison hospice programs while incarcerated. And I have just some quotes to go over. It's very lonely for hospice prisoners, says Avila, remembering that when he saw in the 90s, families are not let in until the day or hours before the person passes. And that's only if they have family to come visit them. As far as pain management and appropriate food, it's just very lonely for that prisoner. And it can really benefit and help if you have inmates in this program that are also helping caregive. Avila still remembers sitting at the bedside of his friends as they pass on, explains that hospice ward is out of sight and out of mind for most prisoners. Nobody in the yard really talks about it. Hospice is the prisoner's forgotten corner. These are my references. And just to hit on awareness again, um, a lot of these programs are not really known about. As I mentioned in my first slide, there are only 75 prisons out of 2,000 in the United States that are running these types of programs. And the prisons that are running these programs are allowing inmates to co-sign and help hand in hand with hospice nurses, prison nurses, and even prison doctors there to help them through this transformative experience, not only for the patient, but for the inmate helping itself. I thank you for listening to my health fair project. And this is Cole Jones signing off.